my name is Sabrina, and today I'll be discussing an issue from Taking Sides by Levine. It's Does military necessity override medical ethics? I got the end of the argument that says no, and I'll go over some background information and then some history provided by research and the book. So, military necessity is a permission on an aggressive subjective to the laws of war. This applies to any kind of force to follow through with the complete submission of the enemy with the least possible amount of money provided to care for time and life of the patients or soldiers or citizens. Now we have the medical ethics, which is a system of moral principles that apply values to the practice of clinical medicine and scientific research. This applies to physicians, doctors, or any upper hand medical assistance provided on the military basis. So, from the book, it said that political scientist Michael L. Gross argues that war brings military and medical values into conflict, and that military necessity often overwhelms a physician's moral obligations, such as relieving suffering. And that's when we think about it from today's society, we think of doctors and physicians with the obligation of treating or caring for a patient based on their injury, but it's come to attention that on a military basis, they have medical officers that aid in interrogating these patients via the physicians who are treating them. So, we have some background about the military necessity that expresses how physicians are designated for soldier caretaking, but they have been known to assist in these interrogation strategies, and they learn this or they practice this via the medical officers uh, that are on hand. And another point is that military physicians point to civilian parallels, so it goes against the human nature of everyone being treated equal on the status of the military basis, and this includes forensic psychiatry and occupational health, and arguing that the medical profession sometimes serves purposes at odds with patient welfare. And that's not true because the medical profession aids in taking care of them, but once they step outside of that in terms of interrogating them and questioning them outside of their injury and outside of their health, well-being, anything that has to do with the injury itself, they are crossing a line that goes against uh, human nature and good rights and their rights as a physician because that's not entitled to them. And then also one of the main reasons that the military necessity does not override medical ethics is because military physicians contribute to interrogation come from his or her psychological insight, their clinical knowledge, and perceived humanistic commitment, and these are known as their moral beliefs. And their moral beliefs come from who they are as a person, who they grew up to be, and it's not taught in physician assistant school or anything like that. This comes down to one of the ethical theories that we studied in lecture, that the moral laws hold for all rational beings. So, from a point of view of a physician, you have a moral belief or law that is going to go across all cultures, all ages, all sexes, because you're taking care of a person. You're not looking at them as a thing or something to provide you information, which is what the medical officers on base have been trained to look at the physicians as. Another point is that the medical ethics examine a clinical case using values, facts, and logic to decide what the best course of action should be. But in the military necessity, they use that information, but they also pull information to the opposing enemy, and that's just taking advantage of everyone in the situation, the patient, the officers, the military bases, the conductors, and the physicians, because they're going against their entitlement. And the medical ethics that was described is what should be overridden military necessity because it is ethical to provide proper medical assistance versus using it to an advantage. And using a patient's to an advantage is not not ethical in this sense because when a patient is in injury is being taken care of because of these injuries that happen on the military bases, they are induced with so much drugs that ridden their nervous systems and they don't think straight and they probably will not even provide proper information that the physician and the medical officers are seeking from them. And it's not right in that sense because um, that reason is backed up by one of the other ethical theories that's stated by Aristotle, that everything aims at some good and that all beings have an end or a purpose. And I trace that back to Aristotle saying because the purpose of the physician is to take care of the injured, and the purpose of the soldiers and citizens is to take care of their union and their people, and they have a trust within their community that they're helping out. And one last point is that the social contract theory that Rousseau said, the social interdependence, is the process of social interaction where certain common goals are established with other people in such a way that each person's results are affected by the actions of others. This goes against the whole board that everyone in this situation, in this conflict, is a chain reaction, but it all comes down to ethical values within the medical field that a patient should not be withheld of information or proper treatment because of information that they may or may not provide properly to the seeking. And I think that's it for today. I hope you guys enjoyed it, and thank you so much for watching.